Hello everyone, welcome back to my channel. So this is the continuation of the part 2, that is part 3, related to the previous question papers of AIIMS-NORCET exam preparation, and this is from the year 2023. Already we have completed the 50 MCQs of mock test, and this is the continuation from the 51. And those who didn't watch till now part 1 and part 2 series, just go and check it out first that and then come to this video. Okay. So now shall we start the video? Let's get started. So now coming to the 51st question. Already I have told you that we are doing this as a mock test. We are not going to explain, going into explanation in detail. Okay. So the 51 question, all are the clinical features of meningitis except. So the options they have given: knuckle rigidity, poor feeding, high pitch cry, constipation. The correct answer, fourth, constipation. 52nd question. What should be the immediate action in case of severe bleeding? So the options they have given: apply pressure to the wound, call for medical assistance. Third option, put a dressing over the wound. Fourth option, cover it with a pad of soft material. The correct answer is first option first, apply pressure to the wound. 53rd question. Adrenaline dose in anaphylactic shock is. So the options they have given: 1:1000 ratio, that is 0.5 ml. Second, 1:10,000 ratio, 0.5 ml. Third point, 1:1000 ratio, 1 ml. Fourth point, 1:10,000, the 1 ml. The correct option 1, 1:1000, 0.5 ml. Next, 54th question. How many movements of hand hygiene have been laid down by WHO? So the options they have given: 7, 8, 6, 5. How many movements of hand hygiene have been laid down by WHO, World Health Organization? The correct answer 4, 5 movements. 55 question. Long-standing high BP may result in. Long-standing high blood pressure may result in. The options they have given: first one, cardiomegaly. Second, cardiac failure. Third, heart attack. Fourth, all of this. The correct answer, option 3, heart attack. 56th question. What is the drug of choice specifically for the management of convulsions in eclampsia? So, what is the drug of choice specifically for the management of convulsion in eclampsia? So, the options they have given: diazepam, pethidine, magnesium sulfate, ampicillin. This is also repeated question asked in so many exams. The correct answer, option 3, magnesium sulfate. 57th question. A client with psychotic depression is receiving haloperidol, that is Haldol. Which of the following side effects is associated with haloperidol? So the options they have given: akathisia, cataracts, diphoresis, polyuria. A client with psychotic depression is receiving the haloperidol, Haldol. So which of the following side effects is associated with haloperidol? I think you have seen the answer. So the options they have given: akathisia, cataracts, diphoresis, polyuria. The correct answer is Option 1. Akathisia. 58th question. Which of the following immediate management to restore BP and peripheral circulation in a client with multiple fractures and fluid loss would be? So the options they have given: RL infusion, blood transfusion, NS infusion, dextrose 5%. Which of the following immediate management to restore BP and peripheral circulation in a client with multiple fractures and fluid loss would be? The correct answer, option 1, that is RL infusion. 59th question. Which of the following hormone is also known as emergency hormone? So the options they have given: cortisol, growth hormone, prolactin, adrenaline. Which hormone is known as emergency hormone? The correct answer, option 4, adrenaline. 60th question. A lung disease caused by prolonged inhalation of cotton fiber dust is. So the options they have given: bagasosis, bicyanosis, farmer's lung, pneumonia. This is also repeated question. The option 2 is the correct answer, that is bicyanosis. 61 question. Height measurement of 2-year-old child is done by. So the options they have given: stadiometer, infantometer, goniometer, refractometer. Height measurement of 2-year-old child. The correct answer, option 1, stadiometer. 62nd question. A nurse is preparing the client morning's NPH insulin dose and notices a clumsy precipitate inside the insulin vial. So the nurse should do. What's the options? Draw up and administer the dose. Second, shake the vial in an attempt to disperse the clumps. Third, draw the dose from a new vial. Fourth, warm the bottle under running water to dissolve the clump. So, when a nurse is preparing the client's morning dose, insulin dose, and notices a clumsy precipitate inside the insulin vial. So, what the nurse has to do? The correct answer, third, draw the dose from a new vial. So, you have to discard that vial. So, 63rd question. DMPA is an injectable contraceptive given every. So, the options they have given: 3rd week, 3 weeks, 3 months, 2 months, 2 years. Means every 3 weeks or every 3 months or every 2 months or every 2 years. The correct answer is option 2, every 3 months. 64th question. Nurse on PICU advised to give a 400 ml of fluid to be given on 8 hours. Drop factor is 60 drops per minute. Nurse will run this fluid at what flow rate? So the options they have given: 13 drops per minute, 50 drops per minute, 17 drops per minute, 30 drops per minute. How to calculate the drop factor? It is there in my channel. Means it's just like a short video. Just look it out. How to calculate the drop factor? So the correct answer is 250 drops per minute. 65 question. The cardinal signs of cardiac arrest include all of the following except. So what are the cardinal signs of the cardiac arrest? Except one. The options they have given: apnea, dilated non-reactive pupils, cold clammy skin, Absence of carotid and femoral pulse. The correct answer option 2, dilated non-reactive pupils. 66th question, which of the following is a mydriatic? So the options they have given atropine, adrenaline, novocaine, silver nitrate. The correct answer option 1, atropine. 67th question, the normal newborn hemoglobin level is. So the options they have given 70 to 20 grams per dl, 12 to 14 grams per dl, 10 to 12 grams per dl, 20 to 25 grams per dl. The correct answer option 1, 17 to 20 grams per dl. 68th question, most sensitive index of the health of a community. The options they have given infant mortality rate, MMR, maternity mortality rate, crude birth rate, crude death rate. Most sensitive index of the health of a community. The option 1, infant mortality rate. 69th question, find the correct statement. So, the options they have given, premature rupture of membranes is contraindication of induction of labor. Second, gestational diabetes is indication of induction of labor. Third, cephalopelvic disproportion, that is CPD, is indication of labor. So which are the statements are correct? So here the options they have given, only first option is the correct. Second, 1, 3 options are correct. Third, second option is correct. Fourth, third statement is correct. I mean, which are the statements are correct? So they have given the options like only first statement is correct, second is first and third statement is correct, third one is second statement is correct, fourth one is third statement is correct. Only 3. Third. I think you have understood the question. So the correct answer option 3. Only second statement is correct. That is, gestational diabetes is indications of induction of labor. Okay. 70th question. Fluid of choice in burn patient. So the options they have given 0.45 normal saline, 0.25 normal saline, 3% normal saline, ringer lactate. There is a whole seminar on topic burns. Okay, total explained in very detail. If you want that, just go and check it out in my channel. So the correct option 4, ringer lactate. 71 question. Identify the blade size. So the options I have given 11, 10A, 15, 12. The answer option 3 is the correct answer, that is blade size is 15. 72nd question. Onset of puberty before the age of 8 years in girls is called. So the options they have given thelarchy, menarche, delayed puberty, precocious puberty. This is also repeated question asked in exams. If the girl attained puberty before the age of 8 years, what we call? The correct option is 4, precocious puberty. 73rd question. Glutaraldehyde is used widely as a cold sterilant to disinfect a variety of heat-sensitive instruments of give the example. Okay, glutaraldehyde will be used to disinfect the instruments which are heat sensitive. So they are asking the example, means give the example of that instrument. So the options they have given: forceps, scissors, laparoscopy instruments, patient bed. The correct answer option 3, laparoscopic instruments. 74th question. What room temperature should be maintained during the period of phototherapy? So the options they have given: 24 to 26 degrees Celsius, 30 to 32 degrees Celsius, 28 to 30 degrees Celsius, 26 to 28 degrees Celsius. The correct answer option 3, 28 to 30 degrees Celsius. 75th question. Choose the correct statement regarding ECG changes in hyperkalemia. So the options they have given: peak P wave, ST depression, shallow T wave and prominent U wave. Second option: flat P wave, prolonged PR interval, widened QRS complex and tall T wave. Normal P wave and QRS complex, rounded T wave, shallow and U wave. Peak P wave, absent QRS complex and prominent U wave. So which statement is correct in case of hyperkalemia? If you want to know the abnormal changes in ECG, first you have to know the normal ECG pattern. So there is a detailed video in my channel about ECG, how to read it out. So if you want, go and check it out once. So here the correct option is 2. 76th question. To perform catheterization, the nurse should place a woman in. So to perform catheterization, so woman has to be placed in which position they are asking. So the options they have given: lithotomy position, dorsal recombinant position, Sims position, Trendelenburg position. It's a direct question and easy question. So the option 2 is the correct answer, that is dorsal recombinant position. 77th question. Stunting refers to. So what do you mean by stunting? So the options they have given: low weight than what is appropriate for a certain height, low BMI, then low weight than what is appropriate for certain age, low height than what is appropriate for certain age. BMI means body mass index. So what do you refer? Stunting. So the option 4 is the correct answer. Low height than what is appropriate for a certain age. 78th question. What are the characteristics findings with regard to CSF after a lumbar puncture is performed on a child who has bacterial meningitis? So the question is, what are the characteristics findings with regards to CSF, that is spinal fluid, after a lumbar puncture is performed on a child who has bacterial meningitis? So the options they have given: CSF is cloudy, elevated neutrophils, elevated proteins, decreased glucose. Second option, CSF is clear, decreased pressure, decreased proteins and increased glucose. CSF is clear, decreased neutrophils, increased proteins, decreased glucose. CSF is cloudy, increased pressure, decreased proteins, increased glucose. It is regard to cerebrospinal fluid. So the option 1 is the correct answer. That is, if the patient is having bacterial meningitis, you will have the findings regarding CSF is: it is cloudy, elevated neutrophils, elevated proteins and decreased glucose. 79th question. What is trimester wise weight gain in pregnancy? Okay, so the options they have given means how much ever the weight gain will be there in pregnancies, first trimester, second trimester and third trimester. So they have given the options like first option is 1, 5, 2 kgs, means in first trimester 1 kg, second trimester 5 kgs, third trimester 2 kgs, like that. In second option 5 to 5 kgs, third option 1, 5, 5 kgs, fourth option 5, 5, 5 kgs. What is trimester wise weight gain in pregnancy? So the correct answer is option 3 is the correct answer. That is, in first trimester 1 kg and second trimester 5 kgs, third trimester 5 kgs. 80th question. The common normal site of implantation of blastocyst in the uterus is, the option they have given, upper uterine portion, second mid uterine area, third low uterine area, fourth lower cervical segment. The common normal site of implantation of blastocyst in the uterus. So the correct option 1, upper uterine portion. So that's all for today's video. The remaining 20 questions are from non-nursing subject. So I won't be discussing them here. As always, if you enjoy this video, please like, share and subscribe to my channel. And don't forget to hit the like button. If you want any videos on any specific topics, just drop a comment in the comment section and I will make a video on that topic. Now let's talk about the upcoming exams. AIIMS, NORCET and RRB. Since both exams have the same subject and the same nursing officer position, so there won't be a separate revision for each. So the revision we are doing for AIIMS, NORCET will also be applicable to the RRB exam and vice versa. So there is no need for a different preparation strategy. If you need explanation on any topics, just let me know in the comments. I have already uploaded several explanation videos on my channel. So be sure to check them out and use them for your revision. We will meet again in the next video with a previous question paper mock test. Until then, take care. Bye.